Tarani, can you hear me? Tarani, can you hear me?
Yes, Dr. Baha. Saya boleh dengar?
Oh,
Clear.
okay, thank you.
Yes, we can hear you, Doctor.
I think
Yes, Dr. Baha.
yeah,
Saya boleh dengar?
yeah, we can hear.
Oh, clear.
Thank you.
We will be starting at 8:30 sharp. We have got like 4 minutes to go. Our Zoom has actually reached maximum capacity. We are going on to YouTube now. For those who cannot log in, then they will log in straight and get onto the YouTube channel instead. Okay, a very good evening to our esteemed panelists and participants. Let me first welcome everyone to this special edition webinar. So it is called the HLP Tips and Tricks. So participants, please keep your mics and your cameras turned off for the duration of this session. You can check the chat box at random intervals, and then we will have some notifications over there. So I will kickstart by explaining a little about the format for this webinar. So we will start off with a short presentation by the representatives of each of the universities. We have 4 universities here today: UM, UKM, USM, as well as UITM. We will then open the forum for the Q&A session. I'm sure this is the one that is the much awaited session. If you can all recall, a Google form was sent out about 3 to 4 weeks ago. And we will be asking the panelists that questions that actually you posed. So amongst our esteemed panelists today, we have Dr. Bahrudin. Dr. Bahrudin is our head of service. He's our national head of service, actually. He needs no introduction. Anyone familiar who's already currently in the field of pediatric dentistry would actually be very familiar with his name. He is usually present during the HLP interviews for pediatric dentistry. And he does have a say in picking the candidates. So we are very thankful that he's present today in this forum. Amongst the other esteemed panelists, we have Associate Professor Dr. Lilia Zura, a representative from UM, who is currently the head of pediatric dentistry. We also have UKM, Dr. Ahmad Shuhud, who is the current program coordinator for the Doctor in Pediatric Dentistry program. UITM is being represented by Dr. Nora Shikin Abu Bakar, who is the postgraduate program director for the Doctor in Pediatric Dentistry program. And USM is fronting Dr. Zuliani Mahmood, who is a pediatric dental specialist and lecturer, and also a member of the interview panel. Some of us might be very familiar with these names, especially those who have attended the HLP interviews during recent times. They have been part of the team that interviews potential candidates for HLP. So to start off our session, can I start with Dr. Lily. So Dr. Lily actually earned her master's in clinical dentistry from Edinburgh. She also presents with a very impressive CV and research focusing on cardiology and pediatric special care dentistry, among others. So, Dr. Lily, may we have a short presentation about the current program that UM is offering?
Thank you, Dr. Tharani. Good evening to all esteemed speakers and colleagues. Okay. Thank you for the brief introduction. I will start sharing my screen. Okay. Okay, can everybody see my screen now? Okay. Okay, so I am, as introduced just now, I am Dr. Lily Azura Shoaib from UM Pediatric Dentistry. Okay, so basically what I'm going to present today is a brief introduction, a brief explanation about the postgraduate program that we have in UM. So as I think maybe everybody knows that our program consisting of the 1+3, which is the MOSC and the Dr. Peden. So the MOSC is the 1-year program and the Dr. Peden is the 3 years program. Okay. Okay, so this the outlines of my presentation. Okay, so basically I'm going to talk about the program structure, the admission requirement, and the qualities that we look for our candidates and what to be alert during the interview. Okay. Okay. So these are again our programs. So we have the Master of Oral Science and the Doctor in Pediatric Dentistry. So the minimum duration is 2 semesters with maximum duration of 8 semesters for MOSC, and the Doctor of Philosophy, which is the doctorate with minimum duration of 4 semesters and maximum duration of 12 semesters. Okay, so this is actually a brief explanation of the study. So the Master of Oral Science is actually a full-time clinical program. Okay, it actually provides a baseline for the learning framework so that the candidate can advance to the doctorate program. So this is actually the prerequisite before you can enter the Doctor in Pediatric Dentistry. Okay. And with this MOSC and elective in pediatric dentistry, you can also, this will also enable the candidates to enter PhD through a research program. And following the 1-year program, you can actually enroll to our Doctor in Pediatric Dentistry, which is a clinical coursework. It is a 3 years program, full-time, with 30% research component and around up to 70% clinical component. Okay, this is quite a compact course. Okay, so having to enroll with Doctor in Pediatric Dentistry, which actually we try to accommodate you so that you can deliver up to the high standard of the professional ethics while adapting to the changing of the needs in the community. Okay. So this is actually the general admissions and requirements. So so basically this is what you need to have. So if you look through here, okay, and you can actually click through the link here, all right, and go to the Dentistry UM where you can have the information about the admission, about the postgraduate handbook, all at that website. Okay, so basically you need a bachelor degree and at least 2 years post-registration, minimum 2 years post-registration to enter the university. Okay, I know that from the Ministry of Health, for you to entitle for the HLP, you might need 4 years 4 years experience before you can apply for HLP.
Okay, that's the end of the streamed.
Sorry. Okay, so you have to make sure you are registered with MDC and both are a current annual practicing certificate. All right, and as listed here, and make sure that you obtain minimum 6 of IELTS and also WET of minimal band 5. So these are the general admission requirements for you to be enabled to be shortlisted for our program. Okay, so these are the requirements that actually needed for you to be shortlisted and to be interviewed for our program. Okay, and okay, exemptions. Okay, so we actually make it compulsory for all our candidates to have basic medical science examinations once you enroll
Thank you
to
very
the
much
NYC
for
program.
organizing this webinar.
Okay, so if you have if you have all this membership, okay, or certificate, if you are with MGTF, MFDS, okay, so you will get exemption from the BMF. So, or BMS, sorry. So what is about the BMS actually? Okay, so actually for UM students, you need to have BMS so that for you to be for you to obtain the Master of Oral Science degree. Okay, so when we interviewed the candidate, okay, when you already have BMS beforehand, any RCS membership, IELTS, and any awards or publication, that will be a bonus point. And of course, good communication skills and personalities will be a bonus point as well. And again, this is a full-time study. We are not open to any part-time study. Okay, and of course, this is open to all, whether you are in government services or in the private sector. And we will prioritize those with secured fundings. Okay, and of course, we want hopefully that we want the dentist to be different from the others, because nowadays with the 21st century learner skill, we need all sorts of things, right? And of course, we have intake quota as well. So it's not that we are being very selective, it's just because of our intake quota. So as long as you can fulfill our entry requirement, then you should be able to be selected as our candidate actually. That is the tips and tricks lah from UM. So what is special about UM? Okay, so actually you can get to meet all these international examiners from overseas. So if anyone who joined our workshop last week, we have Prof. Melton. So they are with our just graduated MSc student. These four, they just graduated. I mean, they just successfully finished their MOSC course. All right. So that is what's a bit of something special about UM. You can meet all these international speakers during your external examiner. And also, I think like other university, we are working together with other specialties, including the medical counterpart, and we also have the clinical attachment locally and overseas. Okay, thanks for watching. So that's all a short briefing from UM.
Thank you so much, Dr. Lily. That was very, very enlightening. I come from like the era of MSc, MClinDen, MDS. So all this doctor in pediatric dentistry, doctorate, DClinDen, and all is something that's very new to me. So I'm sure it's very new to a lot of our counterparts as well. So it's good that today we are having this webinar, and we'll all get to know more actually what is being taught and what is the what is the program like currently going forward with our specialty. So now that we have the presentation from UM, can we have Dr. Noor Ashikin next? So Dr. Noor Ashikin is actually currently the postgraduate program director for the Doctor in Pediatric Dentistry program for UITM. She herself is a specialist in pediatric dentistry, and she obtained her Doctor in Clinical Dentistry from UKM, and she's currently lecturing in UITM as well. So Dr. Shikin, over on to you.
Thank you, Dr. Tarani. Can you hear me? Okay.
Yes, we can.
Thank you. Assalamualaikum and good evening to all panelists and also participants. So first of all, I would like to thank MMPD to give this opportunity for us to sharing information about our program. So I think I shall share the screen. Can you see my screen? Sorry, can you see the presentations?
Yes, we can, Doctor.
Okay, that's good. So, first of all, I think among the 4 others university, we are the juniors in terms of offering the master program in pediatric dentistry, except for UIA, which is recently got the approval for the program. And we are started with 1+3. Okay, so we are started in just brief introduction. We are started in 2019, and we are very proud that our first batch graduating very soon can finish the exam. So this is a simple introduction for the program. So it's 1+3, which is the 1-year program is we call it as a Master of Science in Dentistry, which is in the course code with the preclinical elective pediatric dentistry. So the candidates that have been offered for this program, so in the offer letter, we already stated they will go to the elective, which elective discipline that they will offer. Okay, so and it's then the Doctor in Pediatric Dentistry or Doctor Ped Dent is 3 years specialty program. Okay, for the MSCD, UITM is a UITM policy that we only offer to Bumiputra candidates and also non-Malaysians, which is our international candidate. We offer to international candidates. Okay, and for the MSCD is full-time program, which is 1-year program minimum, but maximum we can go to 4 semesters, which is maximum with 2 years. What we covered or what we've been taught in a MSCD program. So for the first 6 months, okay, candidate will concentrate or focus more to the basic medical sciences, which is the core medical and oral sciences. Okay, by the end of semester 1, so they will be having an exam. Okay, other than that, the research that they also will be exposed with the research, the design and biostatistics, and also multidisciplinary health sciences. Okay, so then on the second semester, the focus will be more to the clinical elective courses. So the during the second semester, we introduced to the basic and fundamental things about pediatric dentistry. Okay, for the candidate to be awarded with a degree, they must pass all the examinations, okay, the BMS and also other part of the requirement of the MSCD program, and they must pass, by the end of the day, they must produce and also pass with the research proposal. Okay, then they will grant awarded with a degree of Master of Science in Dentistry. So following that, then the candidate will go to the Doctor in Pediatric Dentistry course, which is also full-time and 3 years program. Okay, so for the candidate to be awarded with a master degree, this one they must pass the specialty pro exam and also the dissertations. Okay, so this is the minimum requirement. This one I share with you what's the minimum requirement for our university. So actually, if you go to the website, our website, dentistry, I mean, just in UITMs, they have two, for the MFCD, they have the stated different minimum requirement, and also in doctor in pediatric dentistry also there's another one. But in general, when we look for the candidates that come to interview, we combine into two, because definitely we will offer 1+3. Okay. So the qualification is candidate must have a bachelor or equivalent degree in dentistry from local or international university. Okay, as I said previously, for you to enroll to Dr. Pete Dan, you must pass a Master of Science in Dentistry, which is MSCD. Okay. Then in terms of service, he must have minimum of 2 years of clinical practice after the your degree, and he must be candidate must be registered with MDC and also have a annual APC. Okay, for those that international candidate, they must register and get the temporary practicing certificate TPC. Okay, for the interview, they must pass the interview together with the if we don't have a standard ataupun same test or requirement entry for the intake, we change accordingly. Okay. For the other requirement, you must fulfill the health and others required by the HLP. Okay, and also a candidate also requested for the to bring the research proposal and submitted with the application form and bring it during the interview. The other things that could be your added value for your in terms of your chance to be accepted ataupun to be considered to be for our candidates. So you you should have, at least you have successful completion of MJDS or MFDS or equivalence, or you can you have evidence to show that you have research publications. Okay, this is all the added value that we are looking to, and also I think is to see the candidate commitment towards they really show the interest to further or pursue in the program. Okay, I think that's all from me for the introduction of our program.
Thank you so much, Dr. Nurashikin. It's true that not many of us are aware of. We know UITM is providing the postgraduate course, but I think this is one of the first times that even I could actually see in depth what this course actually consists of, and I think this will really help our future candidates when they actually pick out their universities. They actually know what they are getting into. Thank you so much for that. Next, we are going to have Dr. Zuliani Mahmood. So Dr. Zuliani is actually representing USM today. USM actually had their postgraduate in pediatric dentistry program for some time, and then they stopped for a while, and now they have resumed. So Dr. Zuliani herself has a doctor in clinical dentistry from Adelaide, and she also is a fellow of the Royal Australasian College of Dental Surgeons for Australia, which is carries the title of Fracas. She currently lectures in USM, and she's also one of the interview panel for postgraduate studies in pediatric dentistry for USM itself. So over to you, Dr. Zuliani.
Thank you very much, Dr. Sarani, and good evening to all the esteemed speakers and all the members here. Thank you for joining us today. So I'm representing USM. I am the past program head when it was started, and now it was Dr. Fazlinda. So a little bit of introduction for this program, yeah? Let me share screen. Okay. Okay, right. So we have currently the program named Master of Pediatric Dentistry, and you can see here we have current students up there. And what is the Master in Pediatric Dentistry? So you can see the other two universities are now offering DR, Doctor in Pediatric Dentistry. So USM is in the pipeline coming out 24-25 probably. So we are still using the Ped Dent course, but it's similar to the DR Ped Dent 1+3. So this is a coursework postgraduate study, a duration of full-time 8 semesters and maximum of 14 semesters, and you can find information from this website. Yeah. So what does the program consist of? Our structure have got 3 phases. The first phase constitute the first year on the basic sciences, and first semester that will be examination on basic science, and then followed by the second semester, then you come into the more clinical and research work lah. Okay, and the second semester is the research project is being done with the specialty clinics. And the third phase is research projects, specialty clinics, multidisciplinary seminars, and multidisciplinary attachments. In this third year, the students will be attached to several departments, in anesthesia, pediatric surgical, pediatric medical, accident emergency, and as well as OMFS. And then they have the examination in third year, and also the submission of the thesis. And by the fourth year, is concentrate solely to the advanced work of the pediatric dentistry to become a specialist pediatric dentist. Okay, so why USM? So USM being the one of the major referral centers in the East Coast, provide a specialist center. It is well established. Our dental school is next to the hospital, and the existing programs in medicine and dentistry currently exist within the hospital, and you can see that we do quite routinely work together with the medical team because they are just next door. And with this advantage of training programs and the multidisciplinary attachments, as well as later on you'll be attached to the specialist centers, which is recognized by USM, will be consolidated for you to become a specialist in pediatric dentistry. So what are the admission requirements? The applicant should possess a few requirements. Of course, the basic degree, BDS, DDS, or equivalent degrees. At least 3 years of post-registration experience in dentistry. Staff of Ministry of Health must have 3 years compulsory services and obtain at least a credit in Bahasa. Okay. Special requirements. So after that, the candidate will be screened and be called in for an interview for final selection. And after they meet the requirements, which are set from time to time, they will be offered the place. Requirements are set from time to time by the postgraduate committee. So actually, what is it that we're looking for when we select the candidates for to join our master's program? First of all, we look at your personality. You're well to be worked with your colleagues and have confidence to become a specialist. And we ask about some knowledge, basic knowledge. Your advantage or plus would be if you have prior pass marks in your MFDS or equivalent. That are not necessary, but it will be a plus point. we do ask about your research activities or research experience, whether you have been exposed to research projects, whether you have presented as a presenter in any conferences. Those are the criteria, and especially for the attitude part, we want our candidates to be to show the effort and determination, passion, confidence, resilience lah. Because this doing postgraduate studies is not easy, not smooth sailing. There are some hard work required. We do look for some work experience. We wanted to know what background you have achieved so far, and also, of course, the ability for you to work together with the colleagues, with your supervisors, with the staffs. These are basically a very brief introduction of what USM is offering now. We do have DR, the PEDDEN, which is coming soon, because I believe all universities will be offering the same DR 1+3 according to the program standards. Okay, all right, thank you.
Thank you so much, Dr. Zuliani. It was so enlightening for me to know what consists of the program in USM, and then that you are also moving towards the doctor in pediatric dentistry. We have several questions that aim at specific universities, and then we will ask them later on. Last but not least, we have a presentation by Dr. Shohud. So Dr. Shohud is actually representing UKM today. He obtained his master's in clinical dentistry and his advanced clinical diploma in pediatric dentistry from Queen Mary University in London. He's the current program coordinator for the doctorate in pediatric dentistry for UKM. Right, Dr. Shohud, floor is yours.
Right, thank you, Dr. Tarani. Assalamualaikum, and a very good evening to my fellow panelists and also all the participants today. So I'm representing UKM, and I would like to share a little bit about our program that we are offering. So just allow me to share my screen. Right. Okay. So again, so we are offering Dr. PEDDEN program similar to what that have been offered by UITM, UM, and USM as well. And this is the outline of my presentation or introduction today. And this is where we are in Kuala Lumpur campus. So for you that not have known about UKM, we are not in Mbangi, but we are actually in Kuala Lumpur campus, and we are located just next to HTA Kuala Lumpur, next to Dr. Bahruddin hospitals. IJN is there as well, so goes to Chowkit and Kampung Baru area. And we being that we operating as well at Hospital Pakar Kanak-Kanak UKM, which located next to Hospital UKM, the HCTM, where this is where we provide the hospital-based patient management over there, sedation and general anesthesia dental services, and as well as on calls. So this hospital just opened, I think, back in 2021, just 2 years back during the COVID pandemic. And this is our strength. In lecturers, we have Associate Prof. Dr. Nagarajan, Dr. Alida, Dr. Farina, me, myself, Dr. Al-Abarasi, and Dr. Shafiq, who is our special needs specialist. And the course that we are offering is the 1+3 program, which is equivalent to the level 8 of the Malaysian Qualification Framework. And this is a full-time taught course, and which consists of 1 year Master of Applied Sciences, which we provide a selective pediatric dentistry, and a 3-year specialty doctorate degree, which later the candidate or the students will be awarded with Dr. PEDDEN. And the MASCD is the prerequisite and the feeder course to the 3-year specialty doctorate degrees. And the entry requirement for the Master of Applied Science in Dentistry, this one you can log in into our websites, which I will share it later. But in the brief, it should possess undergraduate dental degree, either DDS or BDS or equivalent, which is recognized by the UKM Senate, and registered with the MDC at least 2 years full experience in general dental practice after graduation, and have a proficiency in English language. We accept TOEFL, we accept IBT, IELTS, and also MUET as well. And then should pass the health check as required by UKM, and also pass the interview either face-to-face or through online communication. So this is for the Master of Applied Science in Dentistry, and then this will be the feeder program to our clinical doctorate, which more or less the entry requirement is almost the same, except for the number 2, which possess a Master of Applied Sciences in Dentistry degree or equivalent that is recognized by UKM Senates. What we listed as an equivalent is that sometimes there are some candidates from other universities, for example, Massa College, which already obtained their Master of Applied Sciences, so we can consider the intake of those students into our clinical program. Program structure for the MASCD, Selective Paediatric Dentistry, we have 3 core courses which the students need to take and need to pass it. One is the Applied Medical and Oral Sciences. It is a university exclusive course, meaning that we don't offer to other students, unlike the BMS, where the UM also open it to non-UM enrolled student to take the exams. But for MOS, it's a UKM exclusive course, and we don't provide any waiver, even if the candidate possess BMS in UM or MFDS and or MJDF cert. So meaning that although you have obtained the BMS from UM or MFDS or MJDF Part 2, you still need to take these Applied Medical and Oral Sciences courses. Okay, and apart from that, same as what have been taught in UITM, we have the research methodology and biostatistics, and also professionalism, informatics, and photography in dentistry. Apart from that, we have also offered 2 selective courses, which is the Fundamental in Paediatric Dentistry 1 and 2, and these 3 core courses and 2 selective courses are run parallel, meaning that both in semester 1 and semester 2, you need to undergo these 5 courses over the period of 10 to 11 months. And following that, upon passing all of the examination, then we will offer you the Dr. Pete Dan specialty course, which consists of Science in Paediatric Dentistry, Clinical Paediatric Dentistry, and Applied Research in Dentistry, which will took around 6 semesters or 3 years of the duration of the course for this one. And tuition fees for the MASCD, we charge differently for Malaysian and overseas candidate. So this is a rough estimation, and all other fees are subject to changes following restructuring of the fees, if any. But as far as this year, so this is the fees that has been imposed to the candidates. So in total, it should be around, for a Malaysian candidate, around 320,000 for the whole 4 years, of course. And projection of intake. So we in UKM, for pediatric dentistry, we have this policy of 2 consecutive years of intake, followed by 1 year of non-intake. So for example, we had our intake in 2022 last year, and today also this year also we will have another intake in 2023. So we are not taking any intake in 2024, and we resume our intake in 2025 and 2026, and we will not have any offering in 2027. So the next intake would be in 2025, followed by 2026. And we usually have between 5 to 6 candidates per intake, and this based on the student to specialist ratio and also the student and dental share ratio that is available in our premise. The strength of our program, so we have a well-structured program accredited by the MQA, HPKK UKM. So I think this is the only children-specific specialist hospital in Malaysia. We have women and children hospital in Kuala Lumpur and in Sabah as well. We have Avicenna Women and Children Hospital, specialist hospital in Shah Alam, which is a private hospital. But the children-specific specialist hospital in Malaysia, I think it's only HPKK UKM is offering at the moment. So we don't mix with any adults patient. So all patient below 16 will be treated exclusively at HPKK UKM. And we also have a friendly and enthusiastic specialist with teaching experience of more than 8 years. And also we have produced so far 24 specialists in pediatric dentistry, and including the newly graduated of 5 students, which I think just reported to KKM last Monday, I think, if not mistaken. And some tips during the interviews and what we look for our candidates in UKM. During the interview, your attire should be professionals. Please wear your name tag. I think this is not for us, but mainly for the HLP interviewers. So I'm not sure there is some perkeliling, something that stated that penjawat awam should wear the name tag. So, and during the interview last year, some of the HLP interview, the KKM bahagian Latihan Persekutuan did what we call tegur lah the candidate who not wear name tag. So it's a very pity thing, but I think it should be taken into account. Body language should be relaxed and appropriate, be confident, maintain good eye contact and a smile. CV and logbooks, make sure you have update it, and this will reflect your working experience, so please make sure that you stated everything, and we also would like to have a candidate that already have an attachment with a specialist. Although we stated that it is only a 2-year minimum requirement, is a 2-year post graduation qualification, but we do expect at least the candidate have attached or have an experience dealing with pediatric patients. Okay, so attachment with the specialist in pediatrics is a bonus, and I should say is a must for our program. Private candidate, yes, we receive a number of private candidates. I know that you might not have a specific attachment program in hospital or in government hospitals, but I do know that there are some private hospitals that offer some sort of short-term attachments with the specialists. So I think you can search out for it, and this will enhance your CVs and logbook as well. Research proposal, any research, clinical, experimental, social science studies would be good, but please propose research with novelty, some with the unanswered research gap. So this again will require a lot of reading, or you can ask your specialist any recommendation, but try to get some novelty in your research that will open up our eyes. So this is your wow factor that might enlist you to get accepted in our program. Also, please pay attention to participation in national conferences. So, saying MAPD every year have organized conferences. So please do attend. This will reflect your enthusiasm, your passion for pediatric dentistry. So meaning that you are really interested in doing and pursue the specialty program in pediatrics. And quality assurance program, research experience, extra qualifications, exams, MFDS, MGDF. Although we did not listed it in our part of our minimum requirement, but it is good to have this extra qualification that will actually what we call make sure that you have an extra qualification and beyond your other candidates, because usually we are dealing with 30 to 40 plus candidates coming for interviews every intake. So we need to find someone which possess an exceptional experience, exceptional qualification, so that we can pick the best out of you. Okay, and preparation fundings, we good that if you have secured your fundings, and family arrangement also should be take into account as well, whether you have sorted it out with your spouses, your children, because we are offering the program in UKM in Kuala Lumpur. You are based in Kelantan or Sarawak, for example, and those who have a big families, who will take care of your children, whether they are coming with you to KL or will be staying with your spouses back in your hometown. So it is good if you can sort it out before you come to the interviews. We might ask as well. This will it's not that we are busybody with your personal lives, but we have experienced some of the candidates that need to go back to their hometown every weekend. So this some sort of kacau you punya your study in during the master courses. So as what Dr. Zuliani have said, that master program is very tough, so you need to prepare it mentally. So the family arrangement is quite important as well for you to pay attention on. Okay. So I think I come to the end of my presentation or introduction today. So you can always go to our website www.ukm.my/fperk, okay, and then you can click to the studies and postgraduate program. So you can have my email address down here. If you have any inquiries later on, you can always email me, and I will try my best to answer all your inquiries. So with that, thank you very much.
Thank you so much, Dr. Shahud. That was so comprehensive. I took back quite a number of notes in my own notepad here regarding the AMOS. I feel that's a bit different, and then how it, even if you have BMS and MGDF, it doesn't exempt you. You still have to sit for the exam by UKM, and the fact that UKM is also the program is also a doctorate in pediatric dentistry. I think that's slightly different as well. So now we have all the presentations from our panelists from universities. We are now going to proceed to the Q&A section of our webinar today. So our first question is actually going to be fielded over to Dr. Baha, our head of specialty. Dr. Baha, we have heard from the universities what do they expect and what makes a certain candidate exceptional for them to give them an offer. What do you think in terms of KKM, what makes a candidate shine? And when you are interviewing a candidate, what makes them stand out in your point of view as one of the panelists during HLP interviews?
Thank you, Dr. Tarani. First of all, Assalamualaikum and good evening to everyone in this Zoom meeting. So to answer your question regarding what we are looking for from the candidates who attended the interview, I think what we are looking for is almost similar to what the university are looking for actually. But for from KKM point of view, from MH point of view, we want the candidate to be very knowledgeable, not only in terms of the area that they want to pursue, but also in general of regarding public service, regarding the policy and procedures as a public servant, and also they are up to date in terms of the current issues, current program that has been organized either by Ministry of Health or by the government in general. We also would want our candidate to be ready to serve in any part of Malaysia, actually. So usually the question that we pose to the candidate is that whether they are willing to work anywhere in Malaysia.
And that's a very famous question, Doctor.
Yeah, very famous question. And the answer usually will be yes. They are willing. So I think that's probably the thing that we are looking for, an extra thing that we're looking for in candidates, other than good communication skills, the passion, the interest, and so on.
So basically, it's like well-rounded candidates, not only just on
Yes.
paper, not having the part 1, part 2, and so forth, but they also have relevant general knowledge regarding what's happening, the current issues in Malaysia, as well as those concerning not only the Ministry of Health, but just basic general knowledge about the current happenings in Malaysia itself. Another question that a potential candidate actually asks is how important is seniority and SKT in determining whether they obtain the HLP in terms of from KKM's point of view? What do you think, Dr. Bahar?
Okay, for regarding SKT, I think in the requirement has stated that you must obtain at least 85% marks for at least 3 years within the 5 years of the 5 years of your last service. And these SKT marks will be counted for in the overall markings for the selection, during the selection. So I think the weightage of the SKT is quite a lot. Okay, so it will give impact, or it will give much weightage to the overall markings for each candidate. I didn't get the first part of your question, sorry.
Right, seniority, Dr. Bahar. How important is
Seniority,
seniority?
okay. Seniority, we will consider seniority as well, but it is not in the markings. It's basically at the, probably I will say one of the stages in the selection, probably the last stages of selection, whereby we are looking into the list of candidates based on their marks. And during the meeting between the committee that look at finalizing the selection of the candidates, we will be considering the senior people. We will give priority to the seniors, so that the seniority part will be taken into consideration during the finalizing the candidates that we want to select.
Okay, Dr. Bahar, that's quite clear. And I actually just came to this conclusion that the unis could require 2 or 3 years of experience, but in KKM we do need 4 years of SKT. So you could very well make through the university's requirements, but you may not be able to obtain the HLP by default just because you don't have enough of experience. Is that correct? You don't have 4 years of SKT marks. You may still tick all the boxes for university, but in terms of obtaining the HLP tu yang susah tu sebab tak cukup 4 tahun kan? Okay.
Yes,
I think here's
that's
where
right. Because you have you need 3 years of SKT marks actually. So I think because of that, the oral health program has put at as 4 years, minimum of 4 years before you can apply for HLP.
Okay. Actually, when we opened up this Google form for questions about this, we actually received so many responses, about 200 over responses, and a lot of them were actually those in endos, the new dental officers. So we actually have some questions from them. They wanted to know, Doctor, they actually specifically addressed you, Dr. Baha, as a head of specialty. They say they are interested to be a pediatric dental specialist. As an endo, where do they start, or how do they start? They actually wanted to know where to start and all that. And also they also wanted to know 2 questions. One, how to start. The second one is if they are contract officers, will they still be able to apply for HLP? So these are the 2 things. So will they be able to be accepted by universities? That's a question for our panel of representatives from universities. But from KKM itself, they're asking, are they eligible for a scholarship? So
Okay,
what do you think?
For endos, actually, I think the government has already mentioned that they will be given scholarship. They will be given scholarship under program Latihan Kepakaran. This is different from Hadiah Latihan Persekutuan, which is meant for the permanent officer. So, for them, they have to complete their 3 years contract first, and then they have to request for an extension of 2 years. So during the 2-year extension, they can apply for program Latihan Kepakaran. If you look back at the requirement, so they only can apply after the 4th year of their service. After the 4th year of the service, then they can apply for program Latihan Kepakaran. So during the extension of the 2-year extension, they need to be attached to any pediatric dental clinic, so that they can get more exposure, they can get experience, and also probably guidance from the specialists regarding to go about doing specialist training later on. So following the when they apply for program Latihan Kepakaran, at the same time they can apply. They can apply to they can apply for the slot in university. So if they are being accepted by university, and probably they will be offered the program Latihan Kepakaran. And after they have completed, they pass their to a doctor in pediatric dentistry, for example, then they will they will have to finish up their contract period, and after that they have to leave the service and practice as a specialist in the private sector. Basically, that is the pathway for the endo.
Okay. And there is no hiring of contract specialists for now in KKM. Am I right, Dr. Baha?
Yes, for now, the policy of the government is that they will get the sponsorship to be a specialist, but they will not be absorbed in to be a permanent staff or permanent specialist in Ministry of Health, or even they're probably not going to be hired as a contract specialist. That is the current policy, but that policy might change.
Okay, thank you, Dr. Baha. What about the universities, our panelists? If an endo comes in for the HLP interview, do you have any objections in accepting them, or do you have any, as long as they fulfill your criteria, would you be able to offer them an offer letter? How does it work, Dr. Shikin? How does it work from the point of UiTM?
Okay, to answer the questions, for us, will we screen the potential candidate through the minimum requirements? Okay, we we don't when the candidate fulfill the minimum requirements, okay, and also we will see how many candidates that apply on the particular years. Okay, if, for example, we can afford to call everybody, definitely we will call. But if we have the restriction in terms of timing to call everybody, then we will create again. On top of that, we will see the the added value to the candidates. But having said that, we're not denying their the opportunity to be called to the interview if they fulfill the minimum requirement that for our program. Either they be called or not to be called. What I can say at the moment, I mean, for the 3 years or 4 years that our experience, so far we try to accommodate everybody. We call every potential candidate that send their form, because for us, I think we are limited in terms of we only offer to the, due to the university policy, we only offer to the Bumiputra. Then maybe as compared to UKM, they have many potential candidate that apply. So for us, what I can say through our 4 years experience, we call every single candidates that apply to our program, provided they are fulfill the minimum requirement.
Okay, Dr. Shikin, that makes sense. What about Dr. Shahud, Dr. Lily? What do you all think? Endos, they can apply as long as they fulfill the criteria by universities. Am I right? Set by the university.
Yes, Dr. Tarani, yes, we do call some of the endos that have not finished their compulsory service yet, or the 1 year, 2nd year, or 3rd year endos. But again, in UKM, we still also put into account whether they have already been attached to any pediatric specialist. So that kind of training also would be good because we are fighting with a number of candidates. So this experience is actually valuable for all of the candidates. So endos, if you because I'm not sure whether I think endos have will basically have their service in KP, clinic pergigian. So they don't have any attachment with the specialist yet, or maybe at the 3rd years of their endos. I'm not sure about the KKM's policies over here. But yes, most of the time, the experience attached with the specialist would play an important role as well for us to select our candidates. But yes, we welcome any endos that think that they have fulfilled the criteria. But yeah, we never know in the future. So maybe they get an attachment in the private clinic or so on. So we might as well consider that. But yes, please do update your CVs, your logbooks, so that that will reflect the variety of treatment that you have taken and you have served in the service as well. So I think that should answer the Tarani's question.
Yeah, sure. That answers my question, Dr. Shahud. There's actually a question in the chat box here for Ministry of Health, that is Dr. Baha. The contract years for endo, does it mean like from the the day they start working, or is it when they become a permanent officer only 4 years after that, then they can apply for HLP? Someone has asked that question. Is it 4 years after they become a permanent officer only then they are eligible for HLP? Will then only the 4 years of SKT be counted, or can they actually apply from when they actually already have SKT marks from year 1 or year 2, year 3? Will that be already counted as 4 years punya experience, even though they are not permanent officers yet?
Okay, if we go through the requirements stated, I think it doesn't really tell us whether the 4 years, the years that the officer being a contract officer will be counted. So I'm not very sure about this, but I can find out later on. But if we look at the requirement, it just stated 4 years of experience, 4 years of working experience. So if that is the statement, my understanding is that the years that they have been working as a contract officer can be considered, but I need to confirm that.
Okay. Thanks, Dr. Bahar. That's very kind of you. Okay, there's actually another question in the chat box for a university. If someone is accepted by a university and then after that they didn't manage to get HLP, would they be able to still apply to the same university the following year, or will they be like, blacklisted or something?
Okay, can I answer that again?
Of course, yes, go ahead.
So I think we have experience like that before. Okay, so we have offered a place for the candidate, but the candidate couldn't get the HLP. But as I presented just now, the criteria would be the candidate with secured funding, right? So they won't be blacklisted for the next year, but they still have to they will have to be interviewed again, and they will have to compete with other.
Basically go through the same process again, and it's not like,
right.
they don't get a shortcut just because they got accepted.
Yes,
it's not
exactly. But actually, that would be a benefit for them actually, because they have the experience of being accepted and also being chosen, and they have been interviewed before. But they have to remember, because every year they will be good candidates, so they still have they shouldn't take it for granted. They still have to prepare for
and come in again.
Interview again.
Okay.
Yeah.
All right. Following that question, I'm going to follow up with this question by TX. Does a local university allow deferment? Say kita dah diterima, dapat offer letter tahun ni, tak dapat HLP, kita boleh tak macam postpone ke defer to another year while waiting for funding, or do you straight away have to say no and then reapply? I'm only asking this from experience. I'm from an overseas university, and I deferred by 1 year because I had no funding. So I'm just like heading off that. The next question is, can you defer in a local university? Does it work that way?
As for UM, there was a special case where we can defer a candidate, but provided that they have a letter from their sponsor saying that they will get sponsored next year. So it must be a secure funding letter. So meaning that there are, what do you call that, conditional offer for them. So we can actually defer them, but it's just that the secure funding is needed.
Right, so it's a very special case then that you probably have to get. Okay, all right. So you still need to get a sponsor letter.
Yes,
yeah,
exactly.
Okay, all right. Okay, that's clear.
Sorry, Dr. Tarani, if I can add on that one to that one.
Yeah, sure, of course, Dr. Shikin.
Yeah, for us also, as Dr. Lily said, we have experience as well. We have a very good candidate that come to us that very unfortunate. Maybe it's not her rezeki on that moment yet. I cannot get the HLP, but they come. She came back to us for the interview. Yes, other than the she has apa nama the opportunity experience, but on the other hand, they have also compete with the others, and also normally we will remember this kind of candidate will see the improvement or what is they have doing apa nama in term dia punya career development and all. So actually the chance become tougher because we really looking to that. And for UITM, if they can't secure funding for the then we are not considered to defer for the next intake. Okay, they can try to come, but they have to go through the same process. But we are very, very sorry to say that we are not secure the place for the next intake for the respective candidates. Okay.
Thank you, Dr. Shikin, for that valuable input. I actually have a question on research proposal, Dr. Baha. So basically a candidate, what she said is that she applied, she has a completed research. That means she has done the proposal, she has carried out the research, registered an MRR, got the approval, and then conducted the research at the MOH facility. What happened is when they opened up the HLP applications, she applied. And then she didn't even get a call back for an interview. The reason when she requested, she inquired why didn't she get the interview, they said that we expect only a proposal. We don't want the completed research. What's your input on that? Is it like they only have to submit thing up to the proposal level? That means the methodology and everything is there, but not actually a conducted research, or how does it work actually? Because actually 3 people asked these questions, and when I looked into their profile, they are actually officers in various MOH institutions. So it's legit question.
All right. Yeah. I think their application being rejected, I think fairly because of they didn't fulfill the requirement. So the requirement is that they have to submit a proposal. So meaning that if they submitted a completed research or a research that has been done by others or things like that, probably that would be the reason for them, their application to be rejected. So meaning that we want a new proposal, and from that proposal we want to get to we want some fresh ideas. We want to see whether they can come up with a new idea, can come up with a better research. So actually we want to look into their knowledge on how to conduct a research. So that's why we are looking at proposal, not the research that has been completed.
I understand that aspect, because when I think as an Asian, we always want to be super good in everything. So when someone asks us for proposal, we tend to think, okay, if we finish up, we registered an MRR, we completed the research. Some even go on to publish or present the findings from this study. Then they automatically think that they have the extra points. That means that would make them shine as a candidate. So it's good that this question is asked. So I hope that everyone is aware that they only expect a proposal and not something completed. It doesn't matter even if you have single-handedly conducted the research yourself. It is still only just want a proposal, and it is with their own reasons why they only want a proposal. So if you have completed research, fine, put it up in your CV and put it up in your portfolio, but please bring along your proposal into the interview. Am I right, panelists from universities? What about the university's point of view?
Taranik, if I can add on Dr. Bahrin's comment, so I totally agree. That's why we call it proposal, so meaning that we propose something that not have been done yet or conducted yet. But I'm sure that in any research that you have conducted, they always have some limitations, some shortcomings in your current research. So actually you can translate those kind of limitations, those kind of shortcomings from your previous research into a new research ideas. So so they always have that kind of opportunities. So meaning that any research you can do you can read through the journals. Any dental journals will always pointed out their shortcomings, their limitation of their research as well. So you can actually use that opportunity to actually explore that research gap, that what we call a research gap in clinical research or in any research. But another thing is please differ yourself from an audit. So meaning that a research is not an audit, but yes, you can actually twist it a little bit into a retrospective analysis. So, but there are some what we call a technique that you can apply to transform your audit into a research. So that's also require some skills and mentoring. But yes, do discuss with your specialists or any supervisors, that I do believe that they can also help you out in terms of your designing your research proposal. So that is my point of view on that one, Dr. Tarani.
Lots of people are going to start to email you and ask you to take a look at their proposal, about whether they're on the right track. You have opened a can of worms, Dr. Shohud. They're definitely going to start.
I'm happy to help. I'm happy to help.
Okay. Actually, now we have some specific questions for universities. Okay, Dr. Lily, we have some, and Dr. Shohud, we have a specific question for UKM. So someone actually asked that the training in a local university like and UKM, they don't really focus on trauma, and they don't really have on-call sessions for their postgraduates. And some of them don't really teach you how to remove impacted teeth. But then in KKM, as a specialist, you are required to, this is one of your core duties, on-call and all that. So in real life, according to them, it's like this question says that in real life working scenario, we have to deal with many cases related to complex dental and surgical trauma as well. How does this work then in and UKM when the candidates have less exposure? How would it impact them working in KKM? Maybe Dr. Lily or Dr. Shohud could help answer.
Yes, Dr. Tarani, I just explained in UKM's training what I'm not sure where the information has been circulated, but in UKM, as I explained in my introduction slides just now, we have an exclusive HPKK Children Hospital, so meaning that we are separated from the adults cases. So all the dental cases will directly come to paediatric dentistry unit. And for the past 3 years, so we have introduced all kind of cases to our postgraduates, be it impacted canines, odontom removal, autotransplantation, dental trauma. But and yes, we do also have our OMFS colleague helping out our cases with cleft lip and palate cases, and also some cases of dental fractures. So yes, the candidates will have the opportunity to learn all of this, and we also have on calls for them as well. For UKM students, they will have they are currently having on calls at HTA Hospital Tunku Azizah in Kuala Lumpur, because it's just next door to us. And we also have started the on call at HPKK as well, so they need to go for 2 on calls around 4 to 5 times per month. But MDC and the specialty program also have listed the clinical competencies that should be met by all of the candidates. through the 1+3 program, and all of this has been taken into account. And I think in UKM, that kind of concern should not be of any concern lah. Okay, should be okay. Yeah. So we do provide all kind of treatment and all kind of opportunities for them to do surgical cases as well.
Okay, thank you, Dr. Sharmadan.
Okay, thank you for the question. I think this is quite a favorite question for UM. Okay, so basically, like what Dr. Shuhud mentioned just now, we are working together with our medical counterpart, or are working together with our OS counterpart, and basically there's some pediatric specialists with special interest in surgery. So we did do the traction of impacted canine, the enucleation of cysts, and because we are still sharing with the OS of our OT, so there might be some limitation, but actually we are doing the surgical bits. Okay, and as for now, the Women and Children Hospital, their OT are ready, so we are getting a lot of referral from the medical counterpart, and since few months back, I think since June, every now and then we have OT referrals from our medical counterparts, and so we have to actually create an OT call for our lecturers and our students, and we are actually working very closely with our oncology ward, and we have a lot of BMT patients being referred, cardio, and even from ED. So even though we don't have the after hours on call, but the UM candidates still fulfill the requirements for the 1+3 for now. Okay, and I have also made a survey within our postgraduate, and they said that will be valuable if we can add on call, but they are actually very packed right now. So they said that if we add the on call part, it will be a bit tougher for them to focus on their academic parts. But as I said just now, so because we are starting to have a lot of referrals from the medicals, and even during office hour, they are doing on call during office hour. Even during office hour, they got a lot of cases as well, and they don't have to worry about the surgical bits because we have lecturers with special interest doing all sorts of things.
Thank you so much, Dr. Lily. Dr. Baha, we actually have a question here. If a government candidate dah applied and got an offer from university tapi tak dapat HLP, must they resign from KKM in order to join the university? Also, is it possible they join the program first and then after that in year 2 reapply for HLP? So that means year 1 mungkin dia bayar sendiri, then year 2, year 3, year 4 dia nak cuba apply balik HLP. Is that possible?
No, it's not possible. If they have been offered a place in university and then didn't get any HLP, if they wanted to pursue their specialty training, then they have to resign. Basically, they have to resign. There's no way that they can start the program first and then apply it later.
I know this question because I think during my time, I think I was one of the last ones that they actually had that, where you can actually apply and then you go first and then later on you try to apply for HLP, and then saying that you're already in year 1, then you can try. But after my year, I think, or the year before me, they actually stopped already, and you cannot do that anymore. It's either you obtain the scholarship from the beginning or you don't get it at all. Another question we have is from a private practitioner. Number one is, can they do the program in any university and then get into any one of KKM hospitals to undergo gazettement? That's question 1 for you, Dr. Baha. And then for the universities, they actually wanted to ask, there's 3 private candidates, private dentists who actually wanted to know, Does the uni offer a part-time program? Any universities offer part-time or long distance where, you know, they can study maybe Saturday, Sunday, and then Monday to Friday run their practice? So maybe Dr. Baha, you want to help answer the first question first, the one where if they can, yeah.
All right. Regarding the gazettement, I think what everyone should understand is that the gazettement process that is being done in Ministry of Health is basically for recognition of specialists, and with that recognition, they are eligible to be given allowance pakar. So the gazettement process is not, the gazettement itself is not the requirement to be a specialist in Malaysia. So the criteria or that is required for you to be a specialist in Malaysia is determined by Malaysian Dental Council. So when you have fulfilled the Malaysian Dental Council, actually you can be registered as a specialist, and then you can practice as a specialist. You don't need to undergo the gazettement process. The gazettement process is only applicable to specialists working in Ministry of Health.
Yeah, that's very clear. I think if you go onto the MDC website, they will actually tell you in order to be a specialist practicing in pediatric dentistry, what are the requirements, and definitely undergoing gazettement or being gazetted is not one of the criteria. Thank you for answering that, Dr. Baha. What about the universities? Anyone offering part-time or long distance sort of program for this private practice?
So for unfortunately, we cannot offer that part-time placement because we are, as mentioned just now, we're totally offer for full-time only.
The course load is quite heavy, isn't it, for pediatric dentistry?
Exactly, yes.
If for a doctorate, a D Clinden, M Clinden, MSc, it's really not potentially not possible to do it part-time, I think, just because you end up, you know, instead of having 4 years, you end up 10 years, I think. You just want to do it every Saturday and Sunday. It's really, the course load is really heavy. Okay.
Because you have that 70% clinical and the 30% research.
Correct.
So it's
yes. And then you also, after that, have the attachment with the MOH facility and all. It's really not, and in MOH, you're not possible for you to come only on Saturday, Sundays. So it's a bit difficult. Okay, we have a question, Dr. Baha, about parallel pathway. When will we, like our medical counterparts, have a parallel pathway for pediatric dentistry?
All right. Actually, parallel pathway is another alternative for another alternative for specialist training. Currently, MAPD and also oral health program is looking at the doing parallel pathway, but we are still in the process, in the development. So I'm not very sure how long it will take for it to start, but it is still in progress, I would say.
It's definitely a work in progress, and it's all in the discussion phase. The blueprint is there, and we have, I think, a lot of members of MAPD, including Dr. Kavi and all, they have actually sat down and looked at it comprehensively with members from the Royal College as well. But it is, as what you said, Dr. Baha, very much in the infancy stages, the discussion stages, and it will take some time for it to materialize. Another question here for you, Dr. Baha. Is there any rule that all SDOs and TPKN should agree for a third year endo to do attachment in a specialty setting? They say currently there's a letter, but a lot of them are denied this and they're not allowed to leave primary care for their attachment. Is there any way that KKM can intervene in this manner? Because apparently a lot of them are interested, but they're all stuck in primary care due to the SDOs mentioned that it's difficult due to the lack of officers and manpower, so they need to retain them in primer. So they're asking how can KKM help them out? What do you think?
Actually, according to our health program, they can apply to do the attachment during their 3rd year of endo. So, but it is subjected to the approval by their supervisors, by their SDOs, because working in Ministry of Health, the service is the top priority. If they are needed to serve the people, then the opportunity, then they can't get the opportunity to do the attachment in the 3rd year. But if you look at the policy saying that following the 3rd year, they can apply for extension, a 2-year extension for their preparation for the program Latihan for them to before they can apply for program Latihan Kepakaran. I suppose for the 4th and 5th years, they can be attached to any of the specialists. I think it should for the 4th and 5th year. I don't think the SDO or the YM should not allow, because their application for the extension is basically for the reason for preparation before they can apply for scholarship for the program Latihan Kepakaran. For the 3rd year, probably there's there a bit of restriction because of the need of service. But I think for the 4th and 5th year, it should not be a problem. But for now, I have not known any endos who has applied for this.
Dr. Ba, is it feasible if, like, instead of going full time, they can actually approach the SDO TPN for like maybe 2 days a week or 3 days, maybe 2 days a week? Because 2 days a week, when you times, it's already like 8 days in a month. So we can, like, in KKM, if you're coming 2 days a week, we can plan it out. So you come during new patient clinic day, or you come during OT session. So you do get some exposure. So in the year 3, if you can't get out full time, I guess the option would be to come out part-time first. And university as well, do you have any, like, say Kekangan, say you only want people with full-time experience, or you can accept those who have been attached part-time as well? Because I think as long as the logbook and the other criteria are fulfilled, it shouldn't be a problem if they're attached full-time or not, am I right? As long as, even if they get part-time attachment, it's still they're still a viable candidate to come in for HLP interviews. What do you think, university panelists?
Yes, even the part-time candidates who had part-time attachments can apply, and look at the they have some experience in pediatric dentistry specialty. So yes, we do consider or take into account those who are into part-time as well.
All right. Thank you, Dr. Zilani. On that account, Dr. Zilani, actually, there's one question for USM. Even I'm quite curious. Is it a must to pass records once you complete the 4 years, or can we get away with the the declined dent or impingement or something?
So the current program no longer has got brackets attached to them. In the past, when we first launched the Masters in Pediatric Dentistry, it tied up together with the brackets fellowship in Royal College of Surgeons. So now with the 2020, I think 2 years ago, our program has separated from the Royal College exams. Having said that, they can take the exams outside during the course, because we try to at par with what our programs in the past as well. So yes, but it's no longer considered to be a must, and it's not tied up to the program anymore.
So thank you so much, Dr. Zuliani. And with that, I believe we have come to the end of our webinars, almost the end. So to conclude today, I guess a lot of us had a lot of enlightening information, and we also, like for me, for example, I actually know more about what the programs every university offers. Okay, and I also actually conducting this webinar for the past 4 weeks, looking through all the questions, I also realized that and the endos have a voice, and they are actually, a lot of them are keen to learn, keen to know, and keen to progress. So I guess I hope that they have all logged in and listened, and they can actually see that some way, somehow, there is a pathway for them to become a specialist. Whether or not if it's in KKM or, if they eventually they don't get absorbed and they have to leave, they are doing what they're passionate about. And that I think is important, whether or not you're in government or you're doing it privately. I think at least now they know what is their pathway like. So with that, I thank everyone for logging in. Any questions that you wish to direct, you can direct them to the official MEPD email, and then I will look at them and forward them to the relevant panelists. Do include your full name and your proper email address so that I can actually get back to you. With that, I want to thank all the panelists for taking the time to come online. It's a weekday, it's a weeknight, and it's almost 10 o'clock. I mean, it's already 10 o'clock now. Thank you so much, Dr. Baha. Thank you, Dr. Shikin, Associate Prof. Dr. Lily, Dr. Shuhud, and Dr. Zuliani for being with us today. We thank you so much from MEPT. Believe it or not, everyone, they are not even getting paid anything. They're just here to spend some time to talk to everybody about HLP and to shed some light on the pathway. It's not an easy pathway. All of us, the panelists and me included, as well as other specialists, can attest that the pathway to become a specialist is not a smooth one. It's very rocky, but all I can tell you at the end is it's rewarding. So I wish everyone all the best. And thank you for listening today. All right. Thank you, everyone. Good night.
Okay. Thank you, Dr. Tarani and MBPD. Thank you, everyone.
Thank you.
Thank you. Thank you, Dr. Baha. Thank you, everybody, for being here. Thank you. Thank you again.
Thank you, Tarani. Thank you,
Thank
everybody.
you. Thank you. Thank you, Doctor. Bye-bye.